Hello, everyone. Welcome to another episode of Life Chapter with Bill. Bill and I are so excited to join you one more week. And as we said a couple weeks back, we're only doing our podcast um, twice a month and not every week as we used to because of our schedule. We could not do that. So I'm just reiterate this time for those who said to me, Vivian, I didn't know you guys were still doing your podcast. Yes, we are. We're still here and we're still committed because we enjoy doing life with you guys, right, Velma?
Yes, yes, that is a pleasure. And please, when you listen to the podcast, share, share, share. That's how we will get followers. Okay.
Yeah, like they need to
like and share. Yeah, yeah. Like first, then share.
That's correct.
Wow. Your office looks so studious. What's going on?
My office always look like this.
Goodness, you look like you put some more books in there. What's happening?
I moved the camera over. That's what it is. I moved the camera over to show.
Oh, so you didn't get more studious?
No, I just moved the angle of the camera a different.
Oh, okay, okay. Are you excited about this show we're getting ready to do?
Yes, I am, because it's time for us to put the healthcare workers and nurses and nurse practitioners on the map, and let's see how great. Let's see, but we know this is an awesome profession. And we're excited to have them on. Right, ladies?
Yes.
So we would like you guys to, well, welcome, first of all. I don't remember if we said that. Welcome, ladies. And we just want you to introduce yourself and just say a little bit about yourself. And anything you want to add to that you want to know, Vilma, other than what I just said?
Okay, no, what I want, introduce themselves, say how long they have been in nursing, if they are actively working or retired, and the area of nursing that they are in. Sounds good?
Yes, sounds good.
All right, take it away. We're gonna start with Paula to my left.
Okay, Paula.
Okay. Hello, everyone. My name is Paula Rutledge, and I am a family nurse practitioner. First and foremost, a nurse, RN, and currently I practice as a nurse practitioner. I have been in nursing for, oh my goodness, I can't count, over almost 30 years or more. As a family nurse practitioner, I've worked for 22 years. So the bulk of my time in nursing has been as a family nurse practitioner.
Okay, thank you. And Paula is Dr. Rutledge, really. And she took that part away, but that's Dr. Paula Rutledge. And we will go to my right.
Hi, everyone. I am Monica Harmon, and I have been in nursing for 22 years, going on 23 years. I can't believe it. I'm a public health nurse, and I like to say I'm a public health nurse, educator, and researcher. So everything I do is really about community health and populations and making sure that we have better health to start.
I don't know where the screen is, but Jeanine, I think it's your turn.
Hi, guys. I'm Jeanine Campbell. I'm currently retired on August 1st, 2020. Worked 41 years in nursing with 20 of those as a family nurse practitioner. Prior to that, I worked in critical care. And I'm enjoying retirement.
Wow.
Yeah. Well, congrats on the 41 years there.
Yeah.
How long have you been actively working as a nurse?
Me?
Yes, that you did.
Said it, 41
I did say 41 years, 1979 until 2020.
Okay, yeah. So I think your math is not right. It's 43 years.
If you're counting from we went into nursing, yes, but from graduation.
79 to 2022?
But I retired in 2020.
Oh, please. Okay. She's a veteran. She don't want to say it.
No, I mean, I thought you were asking for active years of nursing, which would be 41.
Okay. All right. Oh, yeah. Wonderful. 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 Thank you all so much. And I am really, really happy to have you all on and talk a little bit about, your profession. And I'm going to ask you some questions. And then I'm going to have you, encourage, people to join the field of nursing, because if you've been in it for 40 something years, there is some good, right?
Yep.
I think so. I think so. So the first thing I want to put out there is during the pandemic and during 2020 and 2021, nurses were seen as heroes. You were all over the news of what you were doing. People were bringing lunches to those in the hospitals. You were talked about, you were on the news, you made headlines. We had a nurse who was the first to get the COVID vaccine. Is that still going on?
You mean in terms of the publicity about?
Yes, and talking and, about nurses. I think it's kind of quiet down. Anybody know that?
It has definitely quieted down in my neck of the woods, because during 2021, my television was just bombarded by pictures of nurses entering the hospital, going into the hospital, people coming on rooftops of apartments and hailing them as they're going in. And I certainly don't see that now. There's a mention of, the work that they're doing, but certainly not at the intensity that I saw then.
Yeah,
Right.
I agree with that as well. But interestingly, what I do see, and this is not in social media, but when I do see patient, one of the things, a common thing that they say is, thank you for all that you do. Almost everyone, thank you for all that you do.
Good, very good, very
Yeah.
good.
I mean, I think for me, it was an elevation of nurses that we're really seeing now. I think before we were kind of we weren't really thought of in healthcare, for all of our knowledge and our skills. And I think unless you were a patient or you had a family member that was a patient, right? You understood what nurses did. You saw it every day. And so I think, it's an elevation, I think, in the general public's mind and in their eyes of what nurses are and what we do.
Yes.
So what is in the news now is the shortage of nurses. They need nurses. The hospitals do not have nurses. Academia do not have nurses. What can you shed some light on what may have happened? Where have all the nurses gone?
Vilma, you mentioned about the pandemic and how we had, after all this time, we were plastered on social media and everybody was talking about us. I would dare to say that as a result of the pandemic, this contribute greatly to, not altogether, but it certainly played a very important role in what we're experiencing now in the shortages of nurses, because during that time, nurses were extended in terms of the long hours that they work, in terms of being overworked, in terms of the stress. There was a lot of stress then. So it's a contribution of some of those factors that caused the shortage, amongst other things. So I'll just speak to that part of it as well. And also, one of the reasons is that we're getting older.
Exactly.
Jeanine just mentioned that she's retired. So a lot of nurses are, they have retired, they're in the process of retiring. So that's another impact on why we have the shortage. So I'll be quiet now and then give the other two ladies a chance to jump in.
I concur. I don't think people are really paying attention to the aging out of nurses. Nurses are getting older, but nurses are known to linger in the profession until they could barely walk. If they couldn't work in their the area that they spent most of their years, they would go to a less demanding area to work, be it in a school or somewhere where the demand on them physically was less. So nurses, to a large extent, were staying in the profession for much longer than we considered normal. By virtue, I think, because of their love of the profession. I don't think it's because they were destitute or needed money. They just loved the profession. But then came the pandemic, and a lot of nurses, apart from being older, some of them had chronic health conditions. So they were sort of forced into earlier retirement than they would have considered had it not been for the pandemic. So that alone immediately caused an immediate shortage of nurses. And you can't immediately replace those nurses. You have to train nurses and then gradually fill the positions. Also, I think nurses, one of the things that contributed to the shortage also is that people were just fearful. Some people were fearful. So again, I would relate it sorry, to the pandemic. People left either because they felt fear of their health being jeopardized, or they felt they didn't want to be jeopardized. You know, I came out early. I mean, I've always wanted to leave nursing when I could literally run off my job. But my decision to retire when I did was prompted because I had my mom at home who was elderly, very frail, and she contracted COVID. And I knew it had to be from me because she's not leaving the house, you know? I mean, so I felt the need to protect her. So I made my decision to leave a little earlier than I probably would have. I probably have been in nursing for another year or two. So that prompted that decision. So yes. Plus, I think even younger people, people who were perhaps considering nursing, themselves became afraid of the unknown. You know, they were afraid. So now they're just determining, do I go into nursing or not? So I think people who ordinarily would have opted for nursing change their minds because of the pandemic, you know?
So I think we've always had a shortage of nurses. I don't think this is anything new. I think, again, the pandemic, as with a lot of other things, has highlighted some of the deficiencies in our healthcare system. You know, what I will say too is that I think nurses have a lot more opportunities that people don't consider. And, you know, that's one of the things I tell people, really with nursing, once you have that skill set and that knowledge base, you really can write your own ticket, right? I think before it was either the hospital, you did the community, and you may have had your specialty, you know, somewhere in between, and you stayed in it. But right now, I mean, nurses are in the boardrooms, nurses are running corporations, they are running hospitals, nurses are in schools, they're everywhere that I don't think we ever conceived nurses could be. The other piece is that nursing is still predominantly female, right? And predominantly white. And so I think those, when you look at our society, where that's the direct opposite of what society looks like. So when you talk about seeing yourself and seeing your future self, I think often some that would be great for nursing don't see themselves as nurses. And I think that's on us, and us meaning the nursing discipline, where we need to do better with advertising really how great our profession is. Yes, it's hard. And I tell people, don't get into nursing if you don't like people and, you know, you don't like to work hard and use their brain, because we're constantly using our brain. I think our profession, out of all the healthcare professions, we touch every last one of them. And we have to know a little bit about those professions so that we can connect our patients in the best way and make sure that we advocate for our patients or clients or inmates, depending on where you work at, it could be different.
Another reason for the shortage, I think, lies in the number of students that we're graduating from the nursing program. That's a big, we can't keep up. Number one, the same thing with faculty. Faculty are getting older, number one, and so they're retiring. And I must say that prior to working in the clinical setting, I worked in academia for 5 years. And there was this one faculty that was 73 years old. And she kept working because we couldn't find people to teach student nurses. So nurses are retiring. We're not meeting the demand for more nurses in the clinical setting. So what you have is that we don't have enough people to teach them. We are turning away qualified applicants. And I read somewhere in 2019, they turned away 80,000 qualified applicants for nursing school. And it was because we did not have qualified nurse educators to teach them. So that's a big, big, big problem and contribute drastically to the nursing shortage that we're now experiencing.
Wow. Thank you. You had a question, Vivian?
I was just wondering, I was like, wow. So my thing is, for people like Jeanine who have so many years of experience, how can we get them or recruit them? Is it a thing where we need to start recruiting those with all those years of experience to start, see if we can able to get them to start educating the next generation, giving them an incentive to start educating the next generation of nurses?
May I say, I know you kind of pointed the question to Jeanine, but one of the things too is that you don't want everyone teaching, right? And I think just because you say, oh, I'm a nurse and I'm a nurse with experience, it doesn't mean you know how to teach, that you know pedagogy. And I think, when I'm reflecting a lot on this issue right now, and, one of the things is people think about a master's in nursing and they think of only nurse practitioner, right? But there are other master's degrees in nursing, particularly nursing education and health administration or other master's degrees, but particularly education for this issue. You actually learn how to educate at all levels, right? You learn about being a clinical instructor. You learn about developing lesson plans, right? You learn about creating objectives for the course, objectives for each session. You learn about creating test items. All of those are important because let's face it, for nursing school, the big deal, unfortunately, is can we get these students in and can they pass the NCLEX? Because that's our exam for us to be able to practice. And you want them to pass on the first try.
Yeah.
And can I also say, in relation to the question that Vivian asked, it's one thing to recruit them, but like I mentioned before, they turn away 80,000 potential qualified students in 2019. So yes, we can recruit them, but we have to start at the root cause. We need more qualified educators. We need more classroom, we need clinical space, we need a lot of resources in order to fund and recruit. Yeah, we recruit them, but we need to have the educators for them. We need to have place to put them. We need to have the resources.
You need to retain them.
And we need recruitment, retainment, and graduation.
Absolutely. One time.
Yes.
I endorse that, because even if a lot of focus is brought to bear on retirees, I see it as only as a stopgap measure. You can't ignore their ages and how long are they going to be there for. For some people, depending on how the era from which they retired, their exposure to or their competence with the computer, with all that's involved. Those are challenges that a lot of older nurses will experience if they never work with that. So if you're coming from a clinical setting, largely, you might be a little bit more handicapped than somebody who's coming out of educational background. So yes, they can try to recruit some of the retirees, bearing in mind that it would be just a stopgap measure just for time. So they really do need to work on recruitment, and getting those people to love nursing enough to want to grow in nursing and fill the needs that exist, the areas of needs that exist.
I was just basically saying, being that we need the educators to educate, and Monica was more probed into what I was saying, why can't we recruit the ones that have, not the older, but the ones that have retired and let them start teaching, giving them incentives to start teaching the next generation. Because like you just said, they turned away 80,000 students. And if we don't have enough individuals to teach, or teachers in that standpoint that have the track record, like Monica said, in regards to know how to formulate a curriculum, or do this stuff, why can't we get them to say, hey, you guys retired, here's some incentive to start teaching, because we need teachers, we need people who have all those knowledge, the years of experience and knowledge that you have, that we can able to prepare the next generation. So that's more of what my question was. How is it a way, like maybe Vilma, you can answer this too, as an educator, a person who is a dean of a nursing program, what avenues have you guys been taking to recruit people that can able to train, that being that this is a problem, that you guys are turning away so many students?
Okay, so I am not familiar with the statistics, but before I answer that, to answer your question in specific, nurses who retire, I think they are tired.
Mhm,
And if you bring them back, you're not going to get the best from them,
mhm.
and there is a gap between those nurses and the new students coming now. And they have so much more that they would need to learn, because even right now, the nursing licensure exam that they take is beginning next year is going to be completely different from what they are used to, which is called the next gen. So there's a whole new learning to know how to prepare students to be successful in taking these exams. So I can see why some of these nurses would be hesitant. And nobody mentioned it when they were talking about the shortage. But one of the things that I've heard, both in academia as well as in the clinical setting, is the compensation.
Yes, most
That
definitely.
is like, things are going up. I am tired of being treated this way. I'm tired of not being given a comparable salary for all my years of going to school. So that is a factor too. And I'm gonna talk about travel nurse. And I
So
was told,
back up a little bit, because I think I'm not a nurse, so I can definitely come from a standpoint of people who you're trying to recruit. So you're saying that nurses are not being paid efficiently? I
you're
never
talking
really
about
thought that.
educators. You were talking about
Educators.
educators.
Okay, all right, okay. Because I was like, I thought nurses were paid very well. But okay, all right. So it's the educators are not being paid effectively
No,
for
And-
training in the
Yeah.
standpoint. Okay.
no, they're
Yeah,
not.
and
They're not.
what we haven't talked about too is that it's one thing to have experience in nursing,
Mhm.
but the state boards of nursing, they require that your programs, that your nurses are at least master's prepared in nursing.
Mhm.
And so we also have a lot of nurses who have master's in other master degrees in other areas,
Mhm.
not in nursing. So you cannot teach at any level without that MSN.
And to add a little bit to that, Monica, is you, first of all, you apply, and if you have a master's, they take you pending the completion of a terminal degree.
Depending
So
on the school, yeah.
they want you to have a terminal degree. So if it's a baccalaureate program or higher, that's a trend now, that you yes, will take you, but complete that terminal degree within X number of years.
All right.
Mhm.
So what's the requirement to become a nurse? How does one do a track record to become a nurse? Back then or now, what is the track record? How can someone, because we're doing this podcast to put an emphasis on the fact that there's a lot of people in the healthcare field We want other people to join. It is a very lucrative career, path, and you guys love it. You all say that people love it for years because that's why you guys don't want to leave. But what is the requirement that, because I hear sometimes that some people can able to become a nurse within 2 years and some 4. Can you guys shed some light on what's the path for becoming a nurse?
Okay, so before they answer that question, and hold that your answers, guys. Before they answer that question, I would not. Yes, nursing is lucrative, but it depends, because as with everything else, I don't care how much money you are being paid. There comes a time when the money does not matter. Depends on the conditions you're working under, depending on the number of patients that you are responsible for, because you have a lot of responsibility. So in the end, the money you get does not keep you there.
Right, and we haven't talked about how many jobs nurses have too. How many of you know people that have like 2, 3, 5 jobs at one time as nurses, right?
To suffice.
Yeah, or it is what it is.
Oh,
Yes. Okay, so now you can answer. I will, seeing that I am hosting this podcast, I will defer to my guest.
Well, there are 4 entry points to nursing to answer your question. So you can be an LPN or an LVN, right? Or you can be an RN. So LPN, LVN just depends on where you live. So some of the southern states, they'll say LVN is licensed vocational nurse, and then more in the northern states is licensed practical nurse, LPN. I'll tell you the difference in a minute. And then with RNs, you have the other 3 entry points. So you can be a diploma nurse, which we have a few of those diploma programs still, and that's from you graduate from the hospital-based program. You can be an associate degree nurse, where you graduate from a community college, or you can be a baccalaureate prepared nurse, or a BSN. And so all 3 do take that NCLEX exam. And then with that baccalaureate, you can be a traditional, where you do that traditional 4-year program, or you can be an accelerated BSN, which means you may have a degree in another discipline. And then you come back and you take some classes and you can sit for the exam. And the difference between the 2 is basically the LPNs, LVNs, they can do assessments, but they cannot hang blood. They cannot give chemotherapy. They cannot pronounce a patient deaf, and they cannot run a code. And ladies, you help me out if I forgot anything else, but.
And they both sit for the same exam. Are they prepared?
No.
LPN has a PN exam.
Okay, all right. Thank you.
You're welcome.
For people like me who don't know the path.
Yeah, so I think the focus of our discussion is going to be centered around the registered nurse, and getting more people, as Paula mentioned, to come into to the shortages, and why so many nurses, and I wasn't even aware that statistics were turned away, or prospective nurses, applicants were turned away. And the reason is not having enough qualified instructors. The other reason too, during COVID 2020, 2021, there was an extreme shortage of clinical sites for the nurses to go in and get their experience. Mm-hmm. So if you don't have the clinical site, then you don't have anywhere they can get their clinical hours. And although they gave they gave leeway to that they could do 50% of their clinical hours with simulation or in a lab and 50% in the clinical area, we cannot just have students in the lab and not touching or seeing a live patient, because the labs are getting very good. They are high fidelity mannequins, equipments that are in the lab. But when you walk in there with a patient, it is different. It is different. So you need that experience.
So what are they doing to make up for that within those 2 years? Being that they weren't able to work on patients. What are
No, they did. I say they allow 50%.
Okay.
50%. So, and the hospitals or the clinical sites were only taking a limited amount of students. So that put pressure on the institution that you can't take the students if you don't have anywhere to put them. You can't get clinical instructors to take them into the clinical area. So don't take them. So, that was one of the reasons that created that statistics of so many qualified applicants being turned away. Okay, so as I know, you are listening to our podcast, and just to remind you, we are speaking with some nurses in different fields, and we are talking about the nursing profession, the shortages, and how we can recruit more people to join the profession. And if you were listening, or you are just decide to join the podcast halfway in, we heard things like the pandemic. We hear retirement. We hear about fear because so many nurses themselves got sick and died, or they saw their family members dying. And that was a lot of emotional stress that the nurses had to go through with so many patients dying around them. We have nurses who had chronic health conditions who, didn't think it was worth it to put themselves in jeopardy. So they left. And as one person said, there was always a shortage of nursing. And then some are just tired, and some cannot, nursing in the clinical area as well as in academia demands more and more. And after a certain stage, you don't want to fulfill these continuing education credits that you need. You don't want to go do another class to show how to, the technology, or to come up with evidence-based practice. You don't want to do research. And these are some of the things that you have to do. You're tired, so you leave. And then it was mentioned as well about, the profession still is predominantly female and predominantly white. So that leads me to my next question. There is a great shortage of minority nurses. And there is a large population of minorities who get sick with chronic health conditions. How can you, or what would you say to encourage more minorities to enter the field of nursing, given all that we just said?
I would start off by saying that, interestingly, a colleague of mine in her dissertation, she looked at ways in which to attract and retain minority nurses and male nurses. And one of the things that she identified was that nursing was not presented to minority. As a matter of fact, minority do not think that they are capable of becoming RNs. They don't think that. That was one of the things that surfaced. And so I think that if we start not at the high school, not when they're getting ready to graduate, I think that if we start at the middle school by introducing to children, to the students that, listen, nursing is a very important profession, and it's one that you should go look at and consider to become one of the team. So I believe, I really do believe that we need to start at middle school. However we do it, to present, whether we have nurses going in to do presentation, nurses, minority nurses, and not just nurses, but minority nurses going in, doing presentation, whether it's on the flu or hand washing, no matter what the subject is, sex education. We should be there as minority to show them that, yes, you can become a nurse, and this is a noble profession, and encourage them. Start there, middle school, not at the high school, because by the time they get to high school, it's formed in their mind that, hey, listen, I can be a nurse, or I should do something else. So I think start in middle school, and even elementary. Just introduce it at that level so that they could understand.
I'm going to go back to something you said. Paula, you said that we should go into. But most times to get in there, you have to be invited. And I'm not sure, I'm just going to put it out there. I'm not sure how many of us are invited in to these institutions.
I don't think,
to
sorry, go ahead.
To speak or to do a presentation.
We shouldn't wait to be invited.
Right.
We should not wait to be invited. We have to be proactive. Go out there, talk to the nurse. Every school has a school nurse. We have to create these relationship with them. Sorry, somebody had something to say. Yeah, we don't wait to be invited, because you won't be invited. This is the kind of society that we live in. We see the need, and for example, the same individual, Dr. McIntosh, who explored this topic extensively, she went to several of the local schools in Wilmington. She had created this relationship with the principal, and so was able to, present the idea of nurses coming in, whether it's I don't know if they call it professional day, or whatever they call it. Career day, thank you. Career day, or whatever. But create these opportunities to go in there.
Yeah.
So I got to put a plug in for the professional organizations as well. So as a member of the National Black Nurses Association, I'm a lifetime member, but also I am a chapter president of one of the chapters. And so we have an initiative with MBNA called the Mini Nurse Academy. And so there's actually a whole toolkit set for how you can go in and engage with communities, with schools. And so I think, and also we get called as a chapter all the time to come into schools and work with their students and talk about our careers. And so I have to also push that, part of it is our professional responsibility to be at places where people can reach us. So like the professional organization as well, and also answering our emails. Right? I know we're all busy. We can all think of 50 million things, we can do during the school day, right? And then we can't take an hour out of our time, but it's, it's very important, because one of those things is that I always tell students, if you're really good in science, consider nursing. If you're really good in math, consider nursing. If you're really good at talking to people, if you're the class clown, consider nursing, because we need all of those skills and then some. And I guarantee you, every experience any of us have had, it may not seem like it was related to healthcare. Oh, it is to nursing.
Mhm.
And that's what we need to really talk about, is how creative you can be as a nurse.
Yeah.
Yeah.
Were you trying to say something, Jeanine? Thank you, Monica. Thank you, Paula.
So I think to a large extent, the public is limited in their knowledge of just how advanced nursing has become, the roles that we have to play, the skills that the nurse brings to the table, the management table, you name it. I remember when I was in high school, we used to have a month per year when in 1 week it was dedicated to career development, and we'd invite professionals from all walks of life to come in and to share with us, how to get into their field, what was it that inspired them. And a lot of people begin to form their sense of what they wanted to do from that initial exposure. So support what Paula said. Nursing recognizes that they are the ones with the need, and therefore it's their responsibility to make the move, to get out there, to inform people, and to make them aware of what it is nursing has to offer. Just very recently, a batch of nurses from the University of the West Indies, they just had a reunion. And one of their projects that they worked on was a commemorative journal, which chronicled the lives of these nurses from student nurses days until where they are now. And of interest was in that class of students, that batch of students, the current director of nursing at the University Hospital of the West Indies came from that batch. The director of the nursing school at the University of the West Indies came from that batch. And they identified a number of other nurses whose career trajectory was just really rapid. A lot of them are in research. And what they've done is made sure that journal has found its way into local libraries, into schools. So when kids see this and see how far you can go and how the power to impact so many lives and so many organizations, they're beginning to get this information really early, and they're seeing their skin tone, they're seeing their own people rising to the very top levels of the various career paths. So they realize that they can do it too, so we're gonna kill that notion that Blacks achieve less, because it's not true, but they need the opportunity. And I think it starts with basic information, education. I'm thinking of, you have take your child to work day. We could work in our nursing setting, our clinical settings, so invite our kids, one of our children who might have an interest, to accompany you to work, to see what it is you do, for them to see, is this something that I'm interested in? There's so many ways. You can go into the library, you can arrange with the librarian to have a presentation, with the schools, in working in cohesion with the schools. You take a class of student into the library, you have a presentation. There are many ways to garner interest, I think. I think resources are there, but it's not tapped into as fully as it could be.
And that's interesting what you guys said, especially what you said, Paula, about going all the way to the middle school. I really think that's really great, because a lot of people don't. When I was growing up, I thought of a nurse like, I don't like blood, so I won't even think about going to healthcare. I never even thought today of all the different field of where you can go into nursing. Like Monica said, that there's teaching, there's an administrative portion. People really don't know that there's different paths you can take in the nursing field, in caring about people. But one thing that we never touched on is why you guys became a nurse. And I think that's key, because some people might just doing it for the money, and people might be doing it for, or, like Paula said, they might not think that they're smart enough to do it, or, is it too far out of my reach? Or what Vilma was saying about the minorities being in it, is it a white thing, or is not a Black thing? But why did you guys become a nurse? Number one, you guys are all female, yeah. Number two, y'all are minorities. Why did you guys become a nurse? Anyone want to start?
Let the veterans start.
I was gonna say,
Okay.
I have to defer.
To the veteran.
So
Yes.
for
Go
me,
ahead.
I entered nursing because my best friend was entering nursing and I was not quite sure what I wanted to do. So I figured she's going into nursing, I'll go into nursing too. So that was what initially prompted me into nursing. But it wasn't long before I grew to love nursing. I love interacting with people. I love to think that the person in that bed could be my mother or my sister. Hence, they're getting the very best care walking out, before they leave the hospital. And I had the opportunity to see the impact that I made on these patients. And you form relationships. And it was different in Jamaica than here, because in Jamaica, you were really valued. People appreciated what you did. I don't know if it's because, I don't know, but people come in and they greeted you. They come back to tell you thanks. They brought you a gift, not that you wanted a gift, but they're coming with the fruits and the stuff, just some way of expressing their gratitude for what you're doing, because they were seeing that you were making a difference in the lives of their family member, And then when you realize, as for me, it was a process where you realize now nursing was opening up. There's so many different areas that you could branch off into. And if you're somebody who wants to self-actualize, then you're going to go along that path. And I think most nurses are coming to that place now where they realize, I just don't have to be, I can be qualified beyond just a bachelor's, and they want to, for them, I suppose it's part of being able to maximize your effect, what you give, you want to be your best prepared. And the opportunities are there for you to advance education. And so you take it, And nursing today, I think, is much more attractive than it was in our day, because there's so much more that you can do. There's so much more. It's still at its core, it's you giving and reaping the reward of seeing changes occurring in the lives of people. But if you're somebody who, you don't want to stay at the bedside. There's just so much other areas that you can go in nursing. So part of it is the exposure, getting a foot in. And then you find that you can take off to so many different aspects of nursing, which was not the case when I just entered nursing. So yeah, pretty much.
Well, for me, I entered nursing because my sister was a nurse, and I could recall this stayed with me. My grandmother was very ill, and she ended up passing. And my sister came, she was in nursing school, she hadn't graduated then. She came over, and I watched her wash the body, prepare the body, and just took care of my grandmother. That stayed with me for a long time. But inherently, I care. I love to help people. And so coupled with seeing her do that, and the whole caring aspect of who I am as an individual drew me into nursing. And I'm really glad I am a nurse, and I will forever be a nurse, because it's so rewarding to help people. Just the little things, a glass of water, turn them in bed, and to see how it improves their outlook, So yes, caring for people brought me into nursing and has kept me there.
And for me, I was one of those little kids that I always fixed everyone's boo-boos, even if they didn't have a boo-boo. I was going to fix it. And I was always interested in healthcare. I wasn't quite sure it was nursing. And I got into college. We didn't even talk about that. And I majored in biology at first, because I was a science nerd, loved the human body, and absolutely hated being a bio major. I think probably zoology did it for me, because I didn't care about animals that much. But when I looked to kind of reset, and I looked at the curriculum for the nurses, I said, oh, this this is what I need to do, because they were taking sociology and psychology and chemistry, you know, all of these. And I was just like, oh, sign me up. You know, and so that's what I think solidified it for me. And so if I can help someone beforehand, you know, before they get to college and spend that money to come right in and major in nursing, you know, that would be great.
And then I like to answer this question also, because I think you have a connection here, being that you were a nurse and you drew your sister to become a nurse. And I think you had an impact on Jeanine too. Am I right in that? So I think you need to answer that question also, Dr. Vilma Davis.
Well, I did not want to be a nurse. I
Ooh.
wanted to be a teacher. And nobody would tell me I was not going to be a teacher. I used to beat every post around the house, every tree. I used to teach every tree their ABCs and how to write, and you didn't write it well, and that's not how you do cursive and all those things. I was good at it. And it came back full circle, because here am I teaching now. But then when the opportunity came and I applied and went into the profession, I thought, why would you have done anything else? But God satisfied what I had in me as a teacher. But he took a different path. And I don't regret it. I loved it, and I still love it. And I want to go back, and I keep going back to it, because there's a misconception out there that you can come into nursing, you make a lot of money. And I'm going to tell you this from a point of truth. Any person, yes, you can make money more than the average job you go into, and nurses can do many jobs, but guess what? It doesn't last. It does not last, because one, you are tired, or two, your disposition is going to be one in which you get kicked out, because your behavior, your disposition, how you speak to your patient, there is so much more than the money. And when you are too tired and running from job, you make careless mistakes. So it does not last. And then what you have to deal with, what you have to see, you know, and the things you have to do for your patients. Some people will not do that, because not everybody start at the top. You have to move those bedpans, clean those butts, turn those bodies, do those feeds, be given different, you know, jobs to do. You know, you start there, and then you climb your way by demonstrating, you know, what you are able to do and how reliable you are, how full of integrity you are. So there is so much more. And I keep telling them, don't, if you are only looking at the money, you will not last, because you're not going to put up with it. Getting up at nights, you know, being called into work when you don't want to, you know, you have all those things that are a part of it. So it doesn't just come by itself. All those are a part of it. And if you don't love people, and it was said before, if you don't love people, if you don't love math, how did Monica put it? You have to love people, love to talk, love math, love science, and something else. You understand? Something else. All those are pieces of it. So we're going to try to wrap up, and I'm going to ask each person to, Vivian, to say, after saying all this, and I hope we didn't turn anybody off, but if you had one thing to say, to tell, you know, about having somebody go into nursing to help with the nursing shortage and to take care of their own because we need more minority nurses out there. What would you say to them?
I would say nursing, you practice from the womb to the tomb. So if you don't like working with elders, you can work with babies. If you don't like working in the hospital, you work in the community. The beauty of nursing is you can change. And so there really shouldn't be any miserable nurses. And I will say that I think it's the best decision I ever made, becoming a nurse. And I think, I had some days when I'm like, why did I become a nurse? And then I have other days like, I know why I became a nurse. And so, you have to definitely be a flexible person and do a lot more self-care as well. Because I think a lot of nurses, we're good at caring for other folks, but we're not good at caring for ourselves. Getting better. Yeah. I'm getting better. Yeah. So, but definitely it's a worthwhile profession. Go for it.
One thing I'd say that nursing prepares you to be a change agent wherever you are because of you being equipped to educate patients. The average patient is ignorant as to how to carry their best self-care. And this is one of the things I loved as a nurse, to be able to teach a patient, for them to now have the power to care for themselves, to understand the consequences of certain decisions that they make, whether it's for good or for bad. And for them to look at me and say, oh, I didn't know that. Why didn't they tell me that before? And now I send out a patient after that educational exposure, equipped and empowered to make changes in their own lives and in their community, in their family, that sets them up for a better health, for improved healthcare maintenance, prevention of illnesses, how to care for themselves with simple issues. If you were caught in a situation where you didn't have ready access to a medical provider, what are the things you can do? And for me, I find was the most empowering part of being a nurse. And just know that you have what it takes to make the difference in the lives of not just one person, because when you impact that one person, they in turn impact the lives of their families and their friends and their community.
My appeal is directed to minority nurses. We need you. If you look at the hospital, patients in the hospital, a lot of patients that are in the hospital currently are patients who suffer with chronic illnesses like diabetes. When you look at the minority population and the percentage of people with that disease, with hypertension, we need you. We need you to be there for them so that they can identify with you. They can trust you enough to accept care, to take their medication. We need you, minority nurses. There's only probably about 7.8% of minority nurses in the US, whereas there's like 73% Caucasian. And I think the 10% Latino or yes. So we need you, minority nurses. We need you to be there. In the coming years, we are seeing more and more minority patients with diabetes, hypertension, asthma, you name it. We need you there to care for them. We need you to give them a sense of it's safe, it's okay to take the medication. So my appeal is, minority nurses, please step up and be there for your grandmother, your children, and the rest of our people. We need you.
Wow, that's an appeal.
It is.
Minority individuals to go into nursing because we need you. Very good. Thank you all, Dr. Paula Rutledge, Miss Monica Harmon, and Miss Jeanine Campbell. It was
Mm.
great. So much to digest. So much to digest. Take us out of here, Vivian.
Yes, definitely. I learned a lot. I think you were on a show before, Monica, and I think you got me changed with certain things. So, you ladies say you have people thinking differently and changing our mindset from the things that we probably used to think what a nurse is and what's needed. I didn't even know the statistics that Paula brought up about only less than 10% of minorities that's nurses. I thought there were a lot more nurses that's minorities than that what she said. I'm really shocked about that. So, for all those who have listened to our podcast today, you see the hearts of these ladies. And they say if you care about people and you want to see change, go into the nursing field because we need your current, what Paula said, we need you. We need people in this field to make an impact, to change our communities, to help people to understand that it's safe and okay to take the medicine that they're giving you, to tell you how to do it, and someone for us to relate to, because sometimes we don't know if we can trust a certain, people or whatever it may be, but might feel more comfortable with someone that looks like us. So we thank you so much, ladies, for the information that you shared and your heart and where you are and how much you love the nursing profession. And we just say once again, thank you guys for listening. And this is Life Chat with Bill. Goodbye. Thank you.
Bye.